A patient calls to request a copy of their medical records. What is the first step that the medical assistant should take? And remember, we have to keep in mind HIPAA compliance while we address this question. Not just protecting the patient from outside intruders to their information, but also there's regulations and rules in terms of obtaining your own health data. So we have to keep that in mind as we look at these choices. So option A says immediately send requested records via email. And there's a couple things that should stand out here. Remember all of those immediately, those strong words, the always, the never, the immediately, okay. Not that that's never the answer, because there are some cases where it's immediately, but you just have to be cautious if it works in this situation. And maybe, but it says via email. So I'm not sure if email would be the most secure method. Maybe some offices, this is how it's performed, but usually it's through some sort of secure portal or maybe a secure fax, or the patient would come in and obtain it themselves. And in this example, we're just giving it out. They're just asking, they're stating their name, they're saying they need the records, and we're just giving it to them. We're just taking their word for it. And what if this isn't actually the patient? What if this is someone trying to get hold of their information? So option A is looking a little suspicious. I don't think that that would be the best choice for this question. So let's eliminate it. We can always come back. Option B says, ask the patient to come to the office without providing a reason. So we're starting off okay. We're saying ask them to come to the office. Maybe depending where you work, the policies they have to come in person. So okay, maybe, but you're not providing any sort of reason. And regardless of what topic this is that we're discussing, if you're asking a patient to do something, and we're just not going to tell you why, there's probably a better choice here. So let's eliminate option B as well. Option C says, inform the patient that medical records cannot be released. And that is usually not the case. Typically, the patient should be allowed to get their medical records. So this would not be a good answer choice. Let's see what option D has to say. Option D says, verify the patient's identity. So good. That was the issue with option A. We were just handing it out without checking if this is who they say they are. So good. We're verifying the patient's identity. Check. And you're going to explain the process for obtaining medical records, meaning that not only are we checking to make sure this is the right person, but it's also addressing the concern that we had up here, saying via email. And we were saying, is that really a secure way to do it? Well, we're explaining the process. So maybe in your office, the process is that it has to be faxed, or they have to come in person, or whatever the rules are. And this will be explained to the patient, and not the without providing a reason, which was the issue with option B. So option D is taking option A and option B and tweaking them, putting them together to appropriately address the situation. So option D will be your correct answer to this question.